Pnawn good afternoon. Today I'll be focusing on vaccination and the enormous amount of work to deliver what is the largest vaccination programme that Wales has ever seen. We now have 2 COVID vaccines that we are using, the Pfizer-BioNTech and Oxford-AstraZeneca vaccines. These are being used to protect thousands of people every day here in Wales. A third vaccine, the Moderna vaccine, was approved for use on Friday, but we won't be able to use that vaccine for a while yet, as the first supplies will not be available to the UK until spring this year. These vaccines offer us a path out of the pandemic. They offer us a brighter future and a different relationship with coronavirus, one without so many rules and restrictions. Together with our NHS, we are working incredibly hard to make sure that people get their jabs as quickly as possible. Today, I'm publishing our vaccination plan. This sets out how we will protect people in Wales over the coming months. It is our ambition to vaccinate all eligible adults by the early autumn. And this is a huge task. We could be offering vaccines to up to 2.5 million adults in Wales, depending on the advice issued by the Joint Committee on Vaccination and Immunisation, you may also refer to as the JCVI. The latest figures that we've published today show that we've made a good start. By 10 o'clock last night, more than 86,000 people had had their first dose. We will be publishing figures every weekday from now on. The plan that I'm publishing today sets out 3 key milestones. By the middle of February, we aim to have offered vaccination to all care home residents and staff, frontline health and social care staff, everyone over the age of 70, and everyone who is on the clinically extremely vulnerable list, or the shielded list. This amounts to about 700,000 people here in Wales. If we can vaccinate this group of people, it would protect those most at risk of serious illness and harm, including mortality, if they catch coronavirus. By the spring, subject to vaccine supply, we will have offered vaccination to everyone in the Phase 1 priority groups. That's everyone over the age of 50 and all those who are at risk if they have an underlying health condition. By the autumn, our focus will have been on offering COVID vaccines to everyone else in line with the latest advice from the JCVI. We're also putting some early markers down. So by the 18th of January, all frontline Welsh ambulance service staff will have been offered a vaccination. All people living and working in care homes will have been offered a vaccination by the end of this month. And the number of GP practices providing vaccines closer to people's homes will have risen to 250 by the end of January as supplies of the Oxford-AstraZeneca vaccine increase. These milestones will of course depend on Wales receiving regular supplies of the vaccines to match our ambitions and our ability to deliver. We have good supplies of the Pfizer vaccine because we've been holding on to stock for the second doses in line with the original MHRA rules. The MHRA are, of course, the independent regulator. You remember that these changed at New Year, and the second dose is now being rolled out up to 12 weeks after the first, which allows us to speed up the rollout of the initial dose. And it's important to remember that the first dose of the vaccine provides significant protection from harm that the virus would otherwise cause. We have more than 250,000 doses of the Pfizer vaccine, which we expect to use by mid-February, with more coming at the end of this month to the start of February. The Pfizer vaccine is mainly being given in mass vaccination centres to frontline health and care staff. But we are also vaccinating care home residents and staff and people over the age of 80 until the Oxford-AstraZeneca vaccine becomes available in much larger volumes. When we started using the Pfizer-BioNTech vaccine in early December, we had just 7 centres, 1 in each of our health boards. Today, we have 22 centres, and that will increase to 35 vaccination centres in the next couple of weeks. Now, these will be a mixture of mass vaccination centres and some smaller clinics. This map shows where those centres are. It will be available online and on social media, and we will keep it updated. We've received about 44,000 doses of the Oxford AstraZeneca vaccine for use in the first fortnight. But we have been given assurances by the UK government that this will increase rapidly from next week, allowing us to increase the scale and the pace of our rollout here in Wales. Now, as you will know by now, the Oxford vaccine can be stored in a fridge and is much easier to transport than the Pfizer vaccine. It is being used to vaccinate the over 80s, and it's been taken to care homes to vaccinate residents and staff. More than 100 GP practices will be running clinics by the end of this week, and we have 14 mobile units taking the vaccine to care homes. Of course, this will then increase to 250 GP practices by the end of this month. The military is supporting the rollout of the vaccination programme in Wales, with 14 immunisers working at centres and 70 other personnel working in the centre. On Friday, the first community pharmacy will start to provide the Oxford vaccine in a 3-day trial that will start in North West Wales. The rollout of the Oxford vaccine will then be extended across primary care. Vaccination is life-saving, and in this pandemic, it could be life-changing for all of us. This is a race against the virus to save as many lives as possible. So Team Wales is rolling out the biggest vaccination programme we have ever seen, with the help of a small army of NHS staff, healthcare professionals, military staff and volunteers. As we speed up the rollout of vaccines across Wales, it's more important than ever that we follow the rules to keep all of us safe. That means staying at home and working from home wherever possible, keeping our distance from others, washing our hands often, good ventilation and air circulation, and if we do have to go out, wearing a face mask when we're in public places. Before I take questions, I want to make people aware that there are a number of scams involving COVID, including a particularly nasty one, in which people have been tricked into paying for a COVID vaccine and then jabbed in the arm. I want to be clear. Our NHS will never ask anyone to pay for a COVID vaccine. These are free. The NHS will never ask for your bank details, and vaccines are not being delivered to your front door by people who have not been identified as NHS staff. Everyone will be contacted directly by our NHS, either by phone or by letter, advising you about where you will have your vaccine. If you think you have been targeted, please tell someone that you trust. Thank you very much. I will now take questions from journalists, but as usual, all the answers will be broadcast live on our social media channels. And the first question today is from Adrian Masters at ITV Wales.
Thank you, Health Minister. When you say that you will, or you hope to have vaccinated 700,000 people by mid-February, do you mean that they would have one dose or both of the doses of the vaccine that was needed? I know that the BMA expressed concern about the decision to only vaccinate, or initially to only vaccinate with one dose when they met you on Friday, and also talked about anger, fear and mistrust amongst doctors, which is not what you want at this stage. How can you address their concerns?
So the position by mid-February is that the first 700,000 people on the priority list should have had their first dose of either vaccine. Now that's really good news because, as you'll have heard, not just from the independent expert Joint Committee on Vaccination and Immunisation, but all 4 chief medical officers across the UK, and indeed Public Health Wales and other public health agencies, each of the vaccines provide a high level of protection against harm from coronavirus. That's really good news for all of us. The second dose is important because it does have some impact on improving the protection, but in particular, we think it will provide longer-term protection as well. And so this is the choice that the JCVI and indeed our chief medical officers have had to weigh up before giving advice to governments across the UK. And their advice was, if you think of it in this way, if you have 2 doses of the vaccine available, you could choose to give that to one person to provide them with full, excellent protection. Or you could decide to give those 2 doses to 2 different people to provide both of them with high-level protection. That's the advice that we have received from the JCVI, from our chief medical officers, from our public health experts. That means we'll actually protect more people, avoid more hospitalisation, and frankly and honestly, the clear advice that I've had is that doing things this way will avoid more deaths. Now, in the face of that very clear advice, I don't see how it would be tenable for me to stand here as a Health Minister for Wales and to decide to put to one side the advice of those public health experts, our JCVI and the Chief Medical Officer, and to instead do something different, knowing very well that the public health advice that I've received is that would cost extra lives unnecessarily. So I understand that changing the advice as it came through when people, some had had their second dose appointments come through, will be unsettling for some people. But there'll be BMA members, of course, who will have given that advice. BMA members who no doubt sit around the JCVI table remotely now to give advice to chief medical officers and governments across the UK and indeed the public. So understand the anxiety some will feel, but I believe this is the right choice to make, and it's my decision, based on the advice. This is how we'll roll out our priorities, and in doing so, we'll provide the best possible protection and will save more lives right across the country.
Thank you. This is a question about childcare, which has come from an ITV Wales viewer, Sarah White, who, but she expresses what many others have asked, and it's a question that I know you've been asked to before now. Why is childcare still open, she asks. We in childcare work in very close contact with children all day. We provide intimate care. We have to comfort the children. In my mind, we've been left to fend for ourselves, and the Welsh Government has no regard for us. What can you say to Sarah and her concerns?
Well, we're acting as ever on the advice. Your first question was about advice we've received about how to have the biggest possible public health impact to avoid mortality and harm to people. And these choices are balanced, of course. Now, the choice about childcare, and in particular about early years childcare, I do understand why people may wonder and ask the questions that are being asked. But the Welsh Government certainly isn't abandoning people to fend for themselves. We're making our choices based on the evidence and advice we receive. And it's still the case that particularly for children, we think that particularly for younger children, they play a lesser role in transmission. And so we're not risking people's safety in that way. And we're also looking at how that point we made earlier about how you protect people at the greatest level of vulnerability from harm. So that's what we're doing. So there'll be people who may be on an early access to the vaccine because they're in one of the priority groups, because of their age or underlying healthcare conditions. So they will have their vaccine early. And childcare is enabled to stay open. We're not requiring childcare businesses to stay open in the private sector. We're providing a framework for businesses to continue to run, to provide childcare that is essential for many people in essential services. Now, I've talked before about the fact that our NHS is running with about 10% of staff vacancies from sickness and from self-isolation requirements, largely driven by COVID. If there weren't childcare available for some of those people, we'd have a more significant challenge with our numbers. So we're thinking about balancing all the different harms in every choice that we're making. We're certainly not forgetting about our childcare workforce or indeed the interests of children and young people. So there'll be more to come and more to learn. And as I've said several times before on this platform, many others, if the evidence changes again, then we have to be prepared to make a different decision. This is all about how we protect the public, all about how we keep Wales safe. Thank you, Adrian. I've now got Owain Clark from BBC Wales.
You claim in your opening statement, Health Minister, to have made a good start in terms of vaccine rollout, but yet we have dozens of people getting in touch with us, uncertain and anxious about when it will be their turn. And some GP surgeries are posting publicly on Twitter saying they are receiving fewer doses than they were expecting. Why do you think that they are so annoyed?
Well, I think a number of people are anxious because this is a worrying time. And it's entirely understandable on a human level why people are concerned. And I think given that we have made a start in Wales, but we recognise that other UK countries have gone slightly faster than we have, I think when we say we have made a good start, that reflects the fact that the 86,000 figure that we can report from yesterday, in terms of people who have had their first dose, does show a significant acceleration on the week before. We've more than doubled the rate of delivery of the vaccine over the last week. So the significant step up in delivery that I've described is already taking place, and that's evidenced by the figures. And you'll continue to see the daily figures, the increasing delivery of the vaccination programme. So I think that will give people confidence. I understand why some general practices will be frustrated about the vaccine supplies, but we're delivering the AstraZeneca vaccine in supplies that we have to keep it going. And as I've said, the availability of that vaccine is the current rate limiting step in significantly increasing our delivery, because we know there are a range of general practices and others who could deliver more if we had more supply. The supply they're being given is supply for the week. It's not the stretch through for the whole population that they're covering. So it's week-to-week supply that's being rolled out. As we get more supply, we'll push out more supply to general practices and others. As I've described, now look forward to community pharmacy coming on board as well. So we have a much greater spread of people who will be able to deliver the programme. I understand why some people are still concerned about when they'll get their appointment. But as you'll know from colleagues on the BBC who have been reporting this today, there are more and more people reporting they've had their vaccine. And really pleasingly, people reporting they've had a very good experience, whether in a mass vaccination centre or with their local general practitioner or with the homes who are going out to provide the vaccine to care homes. So, as I've said, we're making faster progress in the last week. I expect even faster progress this week as we move forward, because we'll need to continue to step up the pace if we're going to get through the first 4 priority groups by the middle of February, as I expect we will do.
Thank you for that. Some might ask why it's taken a month from the appearance of the first vaccine for you to come up with a plan or to publish a plan. And you acknowledge there that perhaps other nations were quicker out of the blocks than Wales. But what was the limiting factor and what was different in terms of our position compared to theirs? You just mentioned your belief that the supply was a limiting factor. Are you saying that Wales got less supply?
No, with respect to, I was talking about supply for general practice to go faster. That's really about the supply of the Oxford AstraZeneca vaccine. About 44,000 doses of that for the first 2 weeks. We think we're going to get significantly more after that. That's the assurance we've had from the UK government, who are responsible for vaccine supply to Wales. Now, that means we will be able to go much faster in general practice, and that's the point that I'm making. We know that with the Pfizer-BioNTech vaccine, initially, the very clear instruction from the regulator, the MHRA, was we had to hold back 50% of that for the second dose. The rules then changed at around about the new year, and we then had the ability to push out more. So again, last week and the week following, and indeed the week following that, you can expect more of that Pfizer-BioNTech vaccine to be pushed out to our National Health Service to then deliver in those mass vaccination centres. So you'll see the rate increasing because we're able to use that vaccine in a different way. And the supplies we've had, in accordance with our population share, we actually got those supplies at the end of December for a supply that's supposed to last us through the month. So we're getting them in batches that mean it's not a week-to-week delivery, it's essentially a month's supply to see us through. We're expecting another delivery of the Pfizer-BioNTech vaccine for Wales at the end of this month, at the start of February. And in the plan, we set out that going at the pace we expect to, we'll run out of that by the middle of February. So that means that the supplies that are due to come in around about the start of February are really important to replenish that stock so we can continue going at pace in our mass vaccination centres. So that's the reality of where we are, and the logistics of what we're trying to do to cover as many people as possible, as quickly as possible. But I am confident that the increase we've seen over this last week, that you'll see in our figure of moving up to 86,000 plus people who have been vaccinated, you can expect to see when I return here again on next Monday a further significant increase, not just in numbers, but an increase again in the rate of what we're able to do. And that's good news for all of us. And I'm tremendously grateful to everyone right across our NHS who has been working on delivering this programme, the people leading and running the service, the military planners who worked alongside them, colleagues in local government who have been really firm friends and very, very constructive in helping us to deliver a greater service. And of course, the staff and the volunteers who are delivering this programme. It really is a Team Wales approach, really big progress in the last week, a step up in pace in the last week, and more to come on exactly that basis in the weeks ahead. Thank you, Owen. I've now got Dan Bevan at LBC.
Thank you, Health Minister. Good afternoon. The First Minister said on Friday that this is not a sprint, but you've said today this is a race to immunise as many people as possible. But you wouldn't have said these targets if they weren't achievable in your views. But there's going to be a lot of moving parts to this, isn't there? Particularly with procurement and distribution. At the moment, there's only one plant that's filling these vaccines. At the moment, it's currently in Wrexham. But if there was any problems there, that's going to cause significant supply chain issues, isn't there? Do you think there needs to be more of those types of plants across the UK and in Wales?
Well, Dan, I've said it's a race against the virus, and we're working as quickly as possible to protect as many people as possible. That's exactly what you'd expect, and the figures that we've released today do demonstrate an increase in the pace of delivery of the vaccine programme within the last week, a more than doubling of the rates of progress. Now, within the UK, it is largely the Wrexham factory that is helping to deliver, to fill the Oxford AstraZeneca vaccine. They also have an ability to do that in Europe, and so there are issues and challenges about getting that vaccine into the country. But we've had supplies from Germany, I believe, where that's also being delivered. So there's more than one centre within the European part of the service, but it's always the case that if there's a problem in manufacturing, then that could delay some of the delivery. But I've not just met with the UK Vaccines Minister, I've also had a meeting with both of the vaccine producers, Pfizer-BioNTech and also with Oxford AstraZeneca. And there is a healthy level of assurance about their ability to supply millions of doses through the UK in the coming weeks and months. So we're in a position where, yes, there are lots of moving parts, but we have enough certainty to be able to go ahead and vaccinate and protect lots more people. And our ability to do more will be dependent on the procurement and supply. And as I say, that's a UK government responsibility. It's then our responsibility to deliver that vaccine across Wales and to protect people here, to allow us to make different choices in our future.
And where does this leave lockdown restrictions? Based on your plan, would it be fair to say that come the spring, we would be able to have far more freedoms than we currently do now?
Well, I'd certainly hope so, Dan, but that really depends on the choices that we're all making. I don't think people should think that because there's a vaccination programme that is increasing in pace, that means that we can suddenly be less responsible about the choices we're making. Because I'm afraid that the pressure on the NHS is severe. And you'll have heard the Chief Medical Officer for England talk about these being the worst days and weeks ahead for the NHS in England, but also a position that is mirrored across the UK. You'll have heard colleagues in Northern Ireland describing the position they face as well. And you will have heard the regular stories from our staff on the front line who are caring for people who are suffering with COVID. We now have more people in critical care beds being treated for COVID than we had in the first peak of the pandemic in the spring. We have more people in our critical care units than at any time in the pandemic. That's something that should make all of us think about what we're prepared to do, about the reasons why we have a stay-at-home lockdown in force, about the consequences of our NHS being overwhelmed. That's why all of us still need to play our part to take care of ourselves and each other. It really is a team effort to keep Wales safe. Thank you, Dan. I've now got Lleici Lynch from S4C.
Diolch, Gweinidog, Cynhadledd. Following photos photos of intensive care units we've seen in the press today, could you give a detailed explanation as to what NHS frontline staff are facing as we speak? And could you inform us when was the last time that you, as the Health Minister, paid a visit to one of our hospitals?
Okay, well, with the figures and the information we've provided, you'll have heard the figures that I gave in the recall session for the Cynhadledd just before the new year. And it's increased since then. At that time, I said that our critical care facilities were running at about 140% of capacity. They're now running at about 150% of capacity. And all of the choices to expand critical care mean we're making other compromises. Compromise in the way that care is delivered both in critical care with our numbers, but equally compromises that are shutting off other areas of activity. So Betsy Cadwallader has had to stop elective surgery in the Wrexham area now because of the pressure they're under. We're seeing that because of the surge in cases that is happening across North Wales, going from east to west. Now that does demonstrate the reality of what our staff are doing. And I have, of course, seen and heard not just messages on social media, but some of the direct evidence of people talking about what they see and have to do at each shift. And people really need to account for the impact on our staff of what they're seeing and doing. That's not just an impact now. We'll have to deal with that for a period of time afterwards, in months and years, as the impact of that is visited upon our staff. So again, all of us need to help our NHS to help us. That's why we all need to do the right thing. I haven't been to an NHS hospital for months. I'm trying to think about the last time I was in one. And that's because we're in a position where the rules have been clear for all of us. And even when we weren't in a stay-at-home period of time, a ministerial visit isn't always something that helps people to get on with doing their job. And our NHS has been extraordinarily busy for a very long time. I certainly don't intend to go to an NHS hospital during the level 4 lockdown. I have a job to do. I have to be here today to deliver this press conference, but for the great majority of the rest of my time, I'm working from home. If I go to an NHS hospital for what would essentially be a photo opportunity, some staff may be pleased to see me. But actually, there'd be a distraction, there'd be a disturbance to how people do their job, and I think I need to be part of setting an example of working from home wherever and whenever possible. After we come out of a stay-at-home lockdown, then I would like to go and see some of our staff on the front line. Apart from anything else, I'd like to be able to say thank you, as I was able to do in the summer when I went to the Royal Gwent and I got to meet in a socially distanced way over 60 staff, and it was a bright and sunny and positive day. I look forward to more such positive days to celebrate what our NHS has done together with colleagues in social care to keep all of us safe at this most extraordinary time that we're living through.
Diolch, Gweinidog. We're aware, after speaking to NHS staff in North Wales, that the system to register for a vaccine is given to staff via a link that could be passed on to other colleagues or maybe even individuals who are not essential workers or part of a priority group. Are you willing to admit that there are flaws in the system relating to the rollout of the vaccine to essential workers and priority groups?
Well, it's always possible. Some people can try to cheat or work their way around the system. No system is foolproof. There's no issue with acknowledging that. This is about all of us, as I say, doing the right thing. And that means not trying to bend or twist the rules to benefit ourselves, friends or colleagues outside it. It means not trying to bend the rules to put other people at risk. And it's really important that people do the right thing with the vaccination programme. That means doing what you're asked to do and booking an appointment, not calling the NHS to say, when will I get my appointment? When you're asked to make that appointment, and again for our frontline staff to do the right thing as well. I understand why people will be anxious about colleagues, friends, family and loved one, but the reason we have a priority list is to protect people as quickly as possible in the highest risk categories. And if we do that in accordance with that priority list, we'll avoid the greatest amount of harm to our most vulnerable citizens. So all of us really do need to do the right thing. Thank you, Flaky. I've now got Andy Davis from Channel 4.
Thank you. Some people may have been surprised to see over the weekend that Wales had, in fact, around 200,000 more vaccines than it had so far administered. Can you understand why that might look like the Welsh Government isn't vaccinating people as fast as it possibly can? And do you accept that the language used by the First Minister about this not being a sprint risks suggesting a lack of urgency? It is a sprint, isn't it? Because every vaccine administered, in effect, is a chance to save a life.
Well, I think that there's the risk of getting too lost in marathon or sprint. The reason why we're talking this being a marathon is it'll take months to get through this. You know, we really don't think, as indeed as the rest of the UK don't think, we'll get through the adult population until the autumn. Now, months of this, well, I think that's a marathon rather than a sprint. We're not going to complete everything within the next few weeks. That's the only point we're really making, because, of course, we're trying to go as fast as possible. And as I've made clear, this is a race against the virus. The damage that is being done, the faster we can vaccinate people in those priority groups, the more we'll be able to do to protect those people from harm, the sooner we'll be able to make choices about releasing some of the restrictions that we're all having to live through. So I just don't want there to be any confusion or a sense that actually there's a lack of urgency here, when actually there's a very real sense of urgency here within the government and indeed our NHS, who are delivering this vaccination programme. And on the figures, as I've dealt with in a previous answer, Andy, the rules have changed about how the Pfizer-BioNTech vaccine could be stored and delivered. We had to store half of that vaccine initially to protect the second dose. Then the independent regulator, the MHRA, changed the rules on that, and indeed the revised advice we had from the independent expert JCVI and the advice we had from chief medical officers about extending the dose interval. That's meant that we can use more of those. So up until the start of the new year, we're essentially keeping back a range of that vaccine because we had to. We're having month-to-month supply, so the supply we have has to last us through the whole month. We're now in a different position to be able to use more of that supply, able to use it in a different way to protect more people, and I do believe we'll make very good use at a rapid pace of the Pfizer-BioNTech vaccine that we have before we get another delivery at the end of this month to the start of the next month, when we then expect and we'll need another delivery because we'll have depleted our stocks and need more to carry on using that in our mass vaccination centres. And as I said, as we get more of the Oxford-AstraZeneca vaccine, we'll be able to do even more in primary care. So you can expect to see, when supply is increasing from Oxford-AstraZeneca, a much greater access and greater pace in primary care, as indeed you'll see much greater pace through our mass vaccination centres over the coming weeks.
I think there may be quite a few NHS workers who might be watching this, interested to hear you raise the issue of the booking system. Before Christmas at another press conference, I raised with you concerns in one health board about the vaccine booking system, that there were NHS workers completely exasperated by the delays in getting through. This morning, I've been speaking to two other NHS workers in another South Wales health board, one of whom they said they spent much of Friday at work internally trying to book a vaccine. They got home, spent 5 hours, called 192 times, but couldn't get through. On Saturday, another 224 failed attempts, and then they gave up. They're angry, and it's adding even more stress, they say. Given the amount of time that the government and the health boards have had to prepare for this, shouldn't these issues have been ironed out by now?
Well, I am aware that many people have had their vaccine and had their appointment without going through the process that you describe. Now, that doesn't mean that that person's experience isn't real and valid and a point of real concern for me and indeed people running our National Health Service, and I understand completely the very real measure of frustration and exasperation that member of NHS staff must feel. So again, Andy, if you can provide me with the detail, because I can't comment individually on the detail that I don't know, then I'd be very happy to make sure that gets looked at again, because I've understood we've seen a real increase in the pace and step of the vaccination programme for our NHS and social care staff. But if there are instances where that's not working as well as it should do, those are opportunities to learn and to improve, and I want to make sure they are taken up to do that, because the frustration of the staff that you describe is an extra amount of pressure that our hard-pressed NHS staff really could do without. So I'd be grateful to receive the details for us to do something about that, because The two biggest priorities for me today are to make sure our NHS doesn't fall over and get overwhelmed by the extraordinary pressure it's under. And we need to look after our staff to make sure that happens in health and social care. Because if social care falls over, we know we'll see a flood of activity coming into our hard-pressed National Health Service. And the other big priority for me is a vaccination programme. Those are the biggest things on my agenda now, my biggest priorities. So please do send me the details and make sure something gets done about it. Thank you. I've now got Mark Smith from Wales Online.
Thank you very much indeed, Health Minister. Would you be able to give us an update on the more infectious strains of coronavirus circulating in Wales? What percentage of cases are thought to be the strain that emerged in the southeast of England? And how many cases are you aware of in Wales of the South African strain of the virus?
On the South African strain of the virus, I know that we've had literally a handful of people from South Africa within the last travel window who have tested positive, and I'm not aware that we've had the genomic testing back from that to test whether that positive test is for the South African variant that is more transmissible, as you say. For the Kent virus strain that we've heard much about, we published a technical advisory group report last week that set out the seeding arrangement of that across the country. And it shows lots within North Wales where we think it's on the way to becoming the dominant strain, if not the dominant. We're not sure that it is the dominant strain in South Wales yet. That's why Public Health Wales are working with colleagues in England to get more of that representative sampling done. So I can't give you an exact figure in South Wales, but in North Wales, we think it's already at or above 50% of the new positive tests that are coming back. So I'm afraid it does appear that it's already the dominant strain within the north of our country. And that reiterates the reasons why we all need to do the right thing, to avoid contact with other people, not to mix unnecessarily with other households, to wash our hands, avoid touching our face, have good ventilation. And if we all do the right thing in this stay-at-home lockdown, we'll ease and reduce the harm that we know is being caused. We'll start to see the COVID rates come down right across the country. We'll see an end of the surging that is taking place in North Wales, and we'll ease the pressure on our National Health Service that otherwise could be overwhelmed. All these things matter even more with the vaccine programme increasing its pace and scale, because that really does show that more is happening to allow us to make different choices in the future, only if we all do the right thing here and now.
Thank you very much indeed. And secondly, you've said already that more than 100 GP surgeries will be running vaccination clinics by the end of this week and 250 by the end of the month. Would you be able to explain a bit more detail about who will be administering the vaccines in GP practices and whether you believe it will have any detrimental impact on those people looking to access their GP for non-COVID related problems?
Well, of course, there's a trade-off between the enormous priority of the vaccination programme and other forms of general practice and primary care. Now, you can't make a choice that says you can have all of your staff delivering this enormous, huge-scale vaccination programme. The only comparable thing would be the smallpox vaccination programme that was run many years ago. That's the scale of what we're trying to do. And you'll have heard Simon Stevens say that in England he equated the getting to the mid-February target of doing the same activity in 5 weeks that the NHS in England had managed to do in 5 months in delivering the seasonal flu vaccine. That's the scale of what we're doing. You can't do that and manage to maintain every other part of our health service, including in primary care. There are choices to be made about where and how those normal activities are run and whether we can pause some of them to deal with the enormous priority of the vaccination programme. Now, some of those are choices that I need to make about the primary care contract, but I know that I think our general practitioners and community pharmacies and lots of our staff understand this will avoid so much harm that we need to make that balanced choice. That isn't necessarily comfortable for everyone, but that's the reality of living with this deadly pandemic. And if we want a way out, we have to make some of those difficult choices to allow all of us to enjoy a different and a better future throughout the rest of 2021. Thank you, Mark. I've now got Adam Hale from the Press Association.
Thank you. Good afternoon, Health Minister. You say in your vaccination plan that people in particular groups will be offered a jab by a certain date. Can you clarify for us whether you're saying those people will be given a first dose by that date, or are you saying that they will just have an appointment in the diary for some time in the future?
We expect to have substantially delivered the vaccine by then, but it does, of course, depend on whether people accept those appointments or rearrange them. So some people may simply refuse. Other people may not be available for other reasons that you could all imagine and understand. So this is about making sure that our NHS is in a position to offer those vaccines and to deliver them, all other things being equal, whether that's supply or indeed people attending for their vaccination appointment.
Thank you. And can you expand further, please, on your comments in your opening statement about wearing a face mask when we're in public places? Is it now Welsh Government guidance to wear masks outdoors if there are other people around us?
No, because we should be socially distanced from other people. But this is about the recognition when you're going out and about in the public, when you're going into indoor spaces, if you're doing a food shop, if you're going into places where you can go, then it's a reminder for people to wear your face coverings when you're doing that. And I see a number of people who have them as they go into different parts of the town that I live in, because if you're going into one shop and into another, if you're going to more than one to do your essential business, then it's easier for some people to keep their face coverings on. There isn't a change in the general advice that we're providing, but this is part of what we can all do to protect ourselves, to maintain our difference, to wear a face covering where possible. I think reinforcing that message is a good thing. Thank you, Adam. We've now got Steve Bagnall from the Daily Post.
Thank you, Health Minister. We've seen pictures of people queuing at vaccination centres and heard from people within those queues that social distancing is not being practiced sometimes, neither are the queues being policed. Is there a danger then that vaccination centres could actually spread the disease unless appropriate measures are taken? And are there protocols for vaccination centres to adhere to prevent this?
Well, all of the mass vaccination centres have a range of marshals in place to help and support people, but fundamentally it's about all of us doing the right thing. And if you're going to a COVID vaccination centre to have a vaccine to protect yourselves and people around you, the last thing you should want to do is to forget about the basics of social distancing. But I do have some sympathy for people, particularly if you've been following the rules, as the great majority of people in Wales have. If you've been staying at home and reducing your contact, then I can understand why if you're in a queue with other people where you're going through a shared experience of getting your vaccine, then some of that social distancing may slip. But we really want people to do the right thing. And that still means you can have a conversation with people who are more than 2 metres away from you, but to please make sure that social distancing is practiced to protect you and to protect other people, not just those in a queue, but the staff who are helping us to deliver this extraordinary vaccination programme. I don't want to see an outbreak that affects our staff and potentially causes a blip in the vaccination programme to reduce the possibility and the availability of staff to help delivering this programme to protect more and more of our vulnerable citizens across Wales. So it's really an appeal for all of us to do the right thing, including if you are going to receive the good news of a protection from COVID with the first shot of one of the 2 vaccines available.
Thank you. And with infection rates in Wrexham at nearly 900 per 100,000 now, why isn't mass testing being considered where in Liverpool it was done when the rates were much lower?
Well, of course, when the rates were much lower in Liverpool, they weren't in a stay-at-home lockdown. It should be the case that we're reducing mixing between houses because it shouldn't be taking place. There are very limited circumstances for people to see and have contact with people who don't live with them. So we have support bubbles. There are very limited other circumstances where it can take place. If we're all doing the right thing, then actually that avoiding contact should reduce the rates eventually. The challenge is where the virus is already seeded, the people you have contact with in your own household are likely to get that virus that is much more transmissible. That is what lies behind the surging rates in North East Wales in particular. So if we're all doing the right thing, then that is the best control measure that we can actually undertake. And of course, people who do have symptoms should go and get a test. The testing infrastructure is still there. And actually, in the last day or two, we've seen a significant increase in testing compared to the position that we were in a week and a half ago. We saw a real lull after the Christmas and New Year period. So if you have symptoms, get a test. Make sure you self-isolate. Please don't mix with other households. If you do that, you'll be doing the best thing possible to get your family safe and other people too. Thank you, Steve. I've now got Rob Taylor from Wrexham.com.
Good afternoon. On the new daily data, the vaccination tab of the Public Health Wales dashboard still gives the old 49,000 figure for doses. The front page overview gives the new updated 86,000 figure. Is that how the updates are planned, or is that an error in reporting? And the dose per data per vaccine information has been circulated by, for example, your colleague, our local MS. And also you've stressed the importance of supplying stocks to understand the context of the process. Can all this data be made public on a daily basis?
Yes, we're committing to provide updated data on vaccinations through every weekday. And indeed, we're the first UK country to do that, because I believe other countries are going to publish later on today. So we're doing what we'd said we'd do. So we're not behind other countries. We're actually ahead by a matter of hours. So we will be able to provide that update on vaccination taking place the day before. There'll always be some correction in terms of data entry, but it should give people a better idea of the pace and scale of the progress that the vaccination programme is making, because I recognise there's wide-scale public interest in this, and I hope that will give people some confidence and assurance. And as for the matter of tidying up the way that the data is presented, I'm sure that we'll learn more lessons in doing that in the next few days. So there's nothing sinister in that. It's simply a matter of having data that is presented in a way that is as quick as possible, but also to give people that trust. And you will continue to see the weekly information published, where we'll have more time to make sure that data is cleaned. And again, as I said in my opening, we'll be able to provide some more information as we're going through the milestones and other data we have available to us. So we'll be able to provide more information, not less, as we continue to make progress.
Thank you. And you've previously said the Welsh Government looks around the world to learn from others about tackling the pandemic. Israel appear to have already managed to vaccinate what would be the equivalent of over half the population of Wales, and that's using the trickier Pfizer vaccine. The details today on the Welsh Government plan appears to be significantly slower than what is and has been done elsewhere. Why is that?
Well, it isn't significantly slower than it was done elsewhere, apart from the example you've given of Israel. So actually, within the UK, we think we'll be able to match the pace, if not do some catch-up with other UK countries, because of significant expansion into primary care. So people can be confident that the vaccination programme was already scaled up over this last week, because you'll have seen the real increase in the rate per day and per week from the figures that we've published. You can see more as we go through the days of this week, and when we get to the end of the week, you should see not just an increase in numbers, but an increase in the pace as well. And I think that should give people real confidence that people are doing exactly what we'd said we'd do. More of the Pfizer-BioNTech vaccine going into mass vaccination centres, the Oxford-AstraZeneca vaccine being used progressively, week on week, in much greater number as supply comes in, and in particular, a really big thanks once again to colleagues in primary care, our general practitioners, and then community pharmacies will be coming on board following the trial that will start in North Wales this week. So there are reasons to be positive, and you'll see from the figures an increase in the pace and the scale of what we're able to do to protect people here in Wales. Thank you, Rob. I've now got Tom Magner from Carers World Live.
Thank you very much, Health Minister. If I heard you correctly and accurately summarised, you're saying that vaccination success stands or falls on whether people accept the vaccine offer and attend for their jab. I'd be interested in your thoughts on a problem that we've had drawn to our attention from a 93-year-old viewer in North Wales. She received a text yesterday, Sunday, offering her a COVID-19 vaccine. There was no date or time or provider in the message. She was invited to make contact. The text message was labelled no reply. Her phone is a basic mobile. She has no internet at home, can't call anyone on a Sunday. So earlier today, she called her GP, but no one answered. She's now really worried that it's her chance gone and she'll be assumed to not want the vaccine. This isn't the first time we've heard that. Aren't you relying too much on everyone having the latest technology and not going back to basic phone calls and answering 24/7 across this issue, employing more people if necessary to do that?
No, and the NHS isn't going to forget and leave people behind. So if there are some of those challenges, and again, the particular details would be really helpful, Tom, so we can take that through, not just with our team here, but with the local health board to see if there are things that we can improve on. But there are plenty of calls that are being made. There are plenty of appointment letters that are being sent out as well. Different people with different contacts may want contact in a different way. So it's doing this as quickly as possible to generate the fastest rate of progress for people to get the coverage and the protection we know that most people are very, very keen to have. But some people may deliberately opt out as opposed to thinking I might have missed my appointment. I wouldn't want people to feel anxious or fearful. So if you provide the details for us, we'll get back to you. And as well as the health board looking at it, we'll make sure whichever health board it is comes back directly to you, so you can assure your viewers that the matter has been taken up with a response provided.
Thank you very much indeed for that, Minister. We'll certainly follow up. And can I now move away from vaccines onto perhaps a more future thinking question from Sylvia from Vale of Glamorgan, and she says, when can Wales expect to have services for post-viral patients with long COVID and ME like they've announced in England?
Well, we have a different pattern of dealing with long COVID here in Wales, and I've issued written statements on this. We've had a range of areas of work because it's about a multidisciplinary team, because the range of symptoms and challenges that people live with long COVID differs from person to person. So it is about a range of different people working together to support that person. And we've got a slightly different frameworks where they're calling them clinics in England, but we recognise a multidisciplinary approach is the right thing. And actually we'll learn more from what we do as we go on and on. We'll learn more from what we're doing here in Wales. And of course we'll learn from what England, Scotland and Northern Ireland are doing too, because none of us have the exact answers. And I think there's a danger that people just assume that whatever anyone else is doing must be better. Whereas actually here in Wales, we've got an approach that's been worked through by clinicians and indeed working with patients themselves. Not every patient who's got long COVID will have been consulted and talked to before the program's been put in place, but we have definitely taken account of patient voice and patient experience in doing so. And I'll be very happy to provide an update in the weeks and months ahead about what we're getting from the multidisciplinary approach that we adopted here in Wales, and then to understand there's more we can do, because this is one of the challenges that we'll be living with for a significant period of time afterwards. Even after we've finally completed this vaccination programme, we know that there'll still be many people living with the after effects of COVID. We know there'll be a huge recovery process for our health service and our economy for many years ahead. So big challenges to get through in the future, but the starting point is we're in a really difficult position now, but there is hope for a better 2021 ahead, because we know that the vaccination provides us with protection, because we know there are different and more positive choices we'll all be able to make at some point during the year ahead. Many thanks, Tom. Thank you to everyone for your time today. I look forward to seeing you again next week.